Hey Jessica, it's Heather. I thought I'd take a minute to respond to your discussion board because I really enjoyed reading it. I totally agree with how you started out because I kind of started mine out the same way. Like the medication assisted treatment can be very valuable and very effective. But I kind of found what you did, like kind of there's mixed probably mixed opinions on the matter as far as like is it helpful or is it not. I know kind of you're saying like they've kind of found some weaknesses, some low quality of the evidence. Interesting enough, one of the articles I found was from like a nationwide survey, more in like U.S. drug courts, but they were saying like the barriers, not only just yours, from looking at the efficacy of one medication over the other, from mortality, abstinence, retention, everything that you're talking about. I interestingly found them talk a lot in this survey about the area. The one of the barriers being the area that the patient might live in, right? So you've got like rural and suburban places like that they don't have the kind of medical treatment that you would in other places. So that to them was a contributing factor, let alone like the cost of it. And then also just their policy about having it or not, because a lot of the articles I was finding was talking about like it has to be a specific treatment kind of place to have these kind of medications because they are so hardcore compared to other ones. So there's a lot of things that go into the ability to even have some of these medications on site, which honestly I appreciate versus just like somebody prescribing whatever, because as we all know there's an opioid a crisis right now, and so the more specific people that can prescribe it, the better. When it came to including psychotherapy, the one of the articles I found talked about it being a combinatorial approach, so a combination, right? So a combination of both showed more progress, because the concern was if you just do medication, you're basically moving from one addiction to another, meaning like you get rid of the drug addiction, you get rid of the opioid addiction, but then are you addicted to that drug? So psychotherapy allows the person to be supported even more. And then of course, most of the articles I found were talking about cognitive behavioral therapy, which has been the most researched theory of counseling. I like how you kind of conclude with the gaps in research, the individuality of each client, how to pick the right drug and the right dosage. I found one of my articles to say like, okay, let's look at the combination of therapy and each of these medications, and only one had really been researched, which is of course the methadone, which is probably the most popular. So one of your research gaps, just like mine, is the setting, their support. And then, of course, just like you said, the range of recovery outcomes. I really like what you had to say. I thought you did a good job. I hope you're having a good week and staying warm. Thanks.